This project is actually addressing one of the biggest problems in our health services, namely the problem of alcohol being one of the lifestyle factors that leads to most mortality and diseases. But it's rarely addressed when people are hospitalized in our somatic hospital system due to a series of causes, mainly the fear of stigma, lack of time, finding it very difficult to ask the questions to the patients, and also lack of awareness. If you are put into a surgical department and you are mending people's leg that they have broken, then it might not be up on front of your mind that perhaps you should talk about alcohol as well with this patient, although it may be that the patient actually broke his leg because he was drunk. We are trying to address this problem by means of this study. This very large problem have been tried being addressed in several ways, and we have done a series of clinical studies trying to make the clinicians be more confident in raising the question of alcohol. And by means of these projects, we collected screening data on how people were drinking, all the patients while hospitalized, how they were drinking before the hospitalization. So we all by a sudden had a lot of data on how the patients were in fact drinking, but we still found it very difficult to engage the clinician in addressing alcohol as a topic. And then all by a sudden it occurred to us that maybe the information on how the patients were drinking were already in their case notes, collected by previous clinicians or during previous hospital stays. So that's why we turned to Ali and his colleagues to see if they could make something out of this data we had on 2,500 patients, if they got access to the information from the clinical case records. Because we thought maybe Ali could figure out if he could already find patterns in the case notes that could identify the patients that we would like the clinicians to approach.
For this problem, we designed an iterative and exploratory research methodology in which we started with collecting data, historical electronic health records of 3,500 patients from Odense University Hospital. We pre-processed those data based on state-of-the-art techniques, and then we developed a machine learning based algorithm in order to identify patients with alcohol use disorder and also for early detection of harmful and hazardous drinkers. For detecting alcohol use disorder positive and alcohol use disorder negative patients, the system has the accuracy of 93% based on random forest algorithm, and for early detection of harmful and hazardous drinkers, we have accuracy around 87 to 89% for harmful and hazardous drinker for a retrospective period of 18 months.
We think that Ali's findings are extremely interesting and intriguing because they indicate that it might be possible to create a decision support tool for the clinicians where they get prompted if the patient is in need for advice about cutting down his alcohol intake. Then we believe that Ali's research can actually help developing such a tool within the case notes, only based on the information in the case notes that are already there. So we're not talking about breaking confidentiality or anything, but helping the clinicians to see that there's a pattern in this case note that actually indicates that precisely this patient is in need of his advice about help, telling the patient what the patient himself can do to get a better prognosis, not to complicate medications by combining it with alcohol use, because that's also the case that a lot of medications can be affected by if you drink at the same time that you take the medications, or advice about cutting down alcohol use before operations and so on, because we also know that if you don't do that, then there's a higher risk for complications and so on. So we really see a perspective in this research leading to a helpful tool to the clinician, making it easier for him to help the patients that are actually in need of help, and not spending time on screening patients who probably don't have a need for any kind of conversation about alcohol.